calculate GCS score. We all know the GCS is going to be calculated. The GCS is going to be calculated as we call it as E4, V5 and M6, right? E is your eye-opening, V is your verbal response, M is your motor response. This is the maximum score that you can give. E is 4, verbal response is 5 and motor is going to be 6, right? Now, quick recap: if a patient has spontaneous eye opening, a score of 4. If he's not opening, if it opens to speech, a score of 3 is given. If still not opening to speech, painful stimulus 2, no opening is 1. Your verbal response to the patient is only to time, place and person, a score of 5. Patient appears to be confused, a score of 4. If patient is abusing you, that is inappropriate words. So whenever you talk about inappropriate words, in the spelling of inappropriate, you have 3 P's. So remember the score of 3. It's easy way to remember it, right? Then you have incomprehensible sounds where he's making eow and all that moaning sounds and all, where you're not able to comprehend, a score of 2. No response is 1. Motor obeys command, moves hands, touches nose, moves away, all that is going to be 6. If he moves to a localized pain, a score of 5. If he withdraws from pain, a score of 4. Abnormal flexion is going to be, which is also called as decorticate rigidity. This is what we call it as the decorticate rigidity, and abnormal extension is decerebrate rigidity. A score of 2 and no response is a score of 1 is given, right? Now in our question, what do you have? You have a patient is going to have, he's not opening to speech, he's opening to a painful stimulus, so score of E2 is given. Inappropriate words, I said 3 P's are there, so verbal response 3 and motor response when he says that withdraws to the pain, so withdrawal to the pain is there, that is present, that means a score of 4 is there. So E2, V3, M4 is the score.